Hello everybody, my name's Rebecca and I would like to share with you a little bit about medical marijuana. What if I told you that you wouldn't have to take opioid pain medications anymore? That there was a natural substance that would help to relieve many of your medical conditions? Would you do it? Would you think about it? Would you take that next step in going to talk to your doctor to see if that would be a great option for you? Well, let me see if I can help you with some of those next steps. Medical marijuana. What is it? The definition of medical marijuana, according to the National Institutes of Health, medical marijuana refers to using the whole unprocessed plant or its extracts to treat symptoms of illness or other conditions. Do you think it would help you? Does just reading that sentence give you the motivation to take that next step? Now I know what you're thinking. Marijuana is a drug. I don't want to be a drug addict. I don't want to be considered one. I don't want to take drugs. It's not a drug, really. It's a natural substance, natural ingredients, comes right from the plant, as I just read to you in that sentence. Medical marijuana can be the new weapon against the opioid epidemic. You don't have to take the opioid pills for all your symptoms. The medical marijuana might be able to help you. Some of the key ingredients in the medical marijuana, one of them is the CBD. What is the CBD? The CBD is the one ingredient that is not used for recreational use because it does not give you the high effect. The CBD can actually help reduce pain and inflammation, can help control epileptic seizures, and can aid in the treating of mental illnesses and addictions. So, what if you're addicted to opioid medications? Do you think the marijuana might help you? That's a good possibility. The FDA actually approved Epidiolex for treatment of 2 forms of childhood epilepsy. As stated in the PowerPoint here, you can see the 2 different types, and it's FDA approved actually, so this form of medical marijuana is actually approved by the government so far. Many states are also legalizing medical marijuana use as well, not just as a recreational medication, which some places already have legalized it for recreational use, but we're talking about for the medical use. Talking about recreational use, the TSH ingredient in medical marijuana, that gives the mind-altering high effect. This is the one that is most misused when it comes to marijuana. Some of the side effects actually increase appetite, so different patients with weight loss, cancer issues that are causing weight loss, giving them this medication could help them gain weight, help them stay healthy. According to one of the doctors that I've interviewed at the office, he gave me some insight on these different things and how they help. Decrease pain, decrease inflammation, swelling, and redness, and decrease in muscle control issues that some people have. He states that he feels that medical marijuana might be a good choice in helping the opioid epidemic. He also thinks that it can also be misused, but does the bad outweigh the good? The different ingredients go along with that. What's next for medical marijuana? They're doing preclinical and clinical trials to help in aid the studies for diseases that affect the immune system. So, seeing if marijuana will help with the cause of HIV and AIDS and MS, along with the muscle control there. Inflammation, pain, seizures, substance use disorders, mental disorders. There's so many possibilities for the medical marijuana, and there's so many uses and studies to see if it'll help you. So what's stopping you from that next step to talk to your doctor to see if medical marijuana is a good choice for you? A great man that I once read about stated that the art of medicine consists in amusing the patient while nature cures the disease. So why don't we let nature help our problems instead of putting opioid medications in our bodies when it's not needed? Thank you.